Today I want to show you the 3-level progression for rolling the IT band. We're going to start by rolling the lateral thigh here. The IT band sits on the outer aspect of the knee here, connects right down here and right up in here. You have your large vastus lateralis muscle that connects into that IT band, as well as the biceps femoris of the hamstring. So we're going to work that whole area. We're going to start by just rolling it up and down, getting that vastus, the edge of the vastus lateralis, between that and the IT band, where a lot of your restrictions will occur. Most of your restrictions will be about mid-thigh down towards the knee. Then we're going to kind of get behind that posterior border of the IT band and into that lateral hamstrings, the biceps femoris. And again, most of your restriction will be down a little bit closer to the knee. So that's our first level, not a weight bearing, just rolling technique. Then we can take the edge and we can glide the soft tissue back and forth in different directions, so we're getting maximum mobility. So we're going to take the edge here, and we're just going to pull and push, pull and push. The skin's moving with it, so we're trying to, any restriction between the skin and the fascia, we're trying to reduce those, trying to improve mobility. And this little quadrant right here is where you're going to have most of your restrictions. So we're going to stay on that area, and then we're going to come into different angles here. You can do this over clothing or right directly on the skin. Kind of slow technique, nice and easy, hitting different angles. Then we can go to the floor, and we can do our weight-bearing, partial weight-bearing technique. This technique, all we do is we're going to hold one end of the handle here on the floor so it doesn't roll. We're going to place the edge right on the border of the IT band. We can do it right on the border of the hamstrings and the IT band, or even the vastus lateralis. Then I'm just going to do a slight movement, little hip flexion, hip extension. I can change the angle easy by just rotating the handles. I can move it out here a little bit more, different angles. So we're looking for those tender spots. Just like when you roll it, we're not rolling it, we're just moving the muscle or the tissue over the wheel. Then we can go into a little extension and flexion of the knee. Real basic, nice and easy, changing the angle, looking for restricted areas to work on.